According to a recent report by the U.S. Census Bureau, close to 8,000 people turn 60 years of age each day. Baby boomers are the fastest growing segment of the nation's population, impacting many areas of healthcare today. Most notably, end-of-life care is one area receiving more and more attention. In fact, 75% of Americans 65 or older die in hospitals and long-term care facilities, while only 25% die at home. It's a statistic that underlines the importance of this aging population becoming educated on the facts about hospice and palliative care.
Palliative care is aggressive pain and symptom management, and it's delivered by an interdisciplinary team that addresses the physical, the emotional, the social, and the spiritual needs of the patient. When patients become terminally ill, and that means that they have months rather than years of life, their focus changes. Now they want comfort-oriented care, and they have the right to elect hospice-level care. Hospice is palliative care, but in addition, our focus is on not only the patient, but on the patient and family. There are additional services, and we are focusing on end-of-life closure.
Since every effort must be made to ensure that a patient's last days are spent in as much comfort as possible and according to the patient's wishes, the role of nursing becomes even more critical.
Nurses are very critical at this time of life because nurses who practice in hospice and palliative care have an expertise in pain and symptom management. They also provide practical and emotional support to people and their families as they're going through this process. They help prepare them for what might happen as the illness progresses, and they are available to teach family members how to care for their loved ones. People should be aware that hospice and palliative care nurses can become certified in this specialty.
Healthcare professionals say nurses can help patients and their loved ones make right choices when living with a life-threatening illness. The Alliance for Excellence in Hospice and Palliative Nursing is the only professional organization of its kind dedicated to provide education and resources to give patients as well as family members the necessary tools to handle the journey with dignity and pride.
Our organization has many opportunities for individuals that are facing serious illnesses in understanding what their choices are, understanding the difficulties and the complexities of that serious illness, and then providing appropriate resources for them to gain the knowledge that will guide them through this process. Americans that are facing serious illnesses can expect from hospice and palliative nurses the level of trust that nursing provides, honest and open communications, guidance towards management of their pain and their symptoms that they're experiencing, and improving their quality of life.
Kathy Spoonmore's husband Alan died from cardiac disease. Spoonmore believes the emotional support and resources her husband and family received from hospice care services was a great help during this difficult time.
They were very helpful in providing information about his medications that he was taking, what we should look for, when we should call them if we needed them. But more than that piece, I think the emotional support that we received was something that I hadn't anticipated, but something we really needed as a family. We were all going in different directions. We all had a different spin on what his diagnosis meant and how long we thought he had to live. And hospice was very good about explaining things and answering our questions, and they were there to work with my family as well as myself.
The Alliance for Excellence in Hospice and Palliative Nursing is comprised of health professionals that strive to give patients the highest and best possible care. The umbrella organization serves as a unified voice representing 3 member organizations: the Hospice and Palliative Nurses Association, the National Board for Certification of Hospice and Palliative Nurses, and the Hospice and Palliative Nurses Foundation. Their shared goal is to support and promote excellence in hospice and palliative nursing.
The Hospice and Palliative Nurses Association is the oldest and largest membership organization that is dedicated to hospice and palliative nurses. Our over 9,000 members include advanced practice and generalist registered nurses, licensed vocational nurses, and nursing assistants. And that makes us unique because we are the only nursing organization that incorporates all members of the nursing team. Our membership shares in a common mission, and that is to promote research, to advance education and educational opportunities, and to engage in public advocacy, all devoted to hospice and palliative nursing, because ultimately that benefits the patients for whom we care.
The process of certification for hospice and palliative care nurses involves sitting for an examination that tests their knowledge and their skill. It also, I think, is a way for nurses to demonstrate their commitment to their profession and the development of their profession. And I think bottom line, it provides a way for people to know that the person caring for their loved one has a certain level of competence and skill. And I think it's important that people learn to ask, are you certified in this area? We currently have in our board over 16,000 certified practitioners in hospice and palliative care. And our certification board is the arm of the Alliance that focuses on certification.
The Hospice and Palliative Nurses Foundation is the fundraising arm of the Alliance. The mission of the foundation is education and research through awards, grants, and scholarships.
As baby boomers age, the flood of this generation will have an enormous impact on our healthcare landscape. Hospice and palliative care is one area that is expected to become more important now and in the future. For more than 20 years, the Alliance of Excellence in Hospice and Palliative Nursing has been committed and sensitive to addressing the needs of patients and their families who face the challenges of life-limiting illnesses. The philosophy of the nationally recognized organization is to help Americans understand the complex healthcare system, as well as provide education, resources, and support for the end-of-life journey.
Americans experience a great deal of difficulty in facing the complex healthcare system in which we exist, but also in understanding the complexities of the serious illness that their family member or they are experiencing. Hospice and palliative nurses are there to guide them through the process, to give them the directions that they might need to make their pain and their symptoms less difficult, to make sure that they achieve the quality of life they highly seek.
The Alliance seeks to develop services and resources through its member organizations that will provide for not only the physical care needs of patients and their loved ones, but the coping skills that are required as persons look toward the end of their life. Our shared goal in our member organizations and in the mission of the Alliance is to provide for the best possible nursing resources and caregiving for patients and their loved ones so that they can really live well until they die.
Statistics indicate that the public's trust in nurses is greater than in any other healthcare provider. With the Alliance for Excellence in Hospice and Palliative Nursing, you can expect and count on the best possible care. For more information on the Alliance for Excellence in Hospice and Palliative Nursing and their services, visit theallianceforexcellence.org or call 866-651-2267.